Hi Sophie, can you tell us a little bit about your research?
Sure. So child sexual exploitation is something that's hidden and it happens out of sight. And it's also something that can be really hard for young people to come forward for help and to know there's people there that they can trust. So how do you identify when a young person is experiencing this abuse? And traditionally, that's been through a risk assessment where practitioners have been looking for things like young people running away, young people, if they're drinking alcohol, if there's substance misuse, if they're hanging out in places they shouldn't be. So we talked to young people, we talked to social workers, we talked to carers as well. And we also went back to case files where young people have been assessed for their risk. We looked at what people did or didn't do, and we looked at what happened to those young people. What we found is that risk had come to mean the things that young people do. And the problem with that is that young people are then the focus in a way that they're the problem. So as a result, what we found is that the best thing that we can do is assess for care and support needs. So we've moved away in Wales from a tick box risk assessment style, and we have a signs and symptoms checker. And what that means is it's an A for professionals. So it's a big, these are the things that will raise the flag. So if you're worried about a young person, here's a way of piecing the jigsaw together. And this is how you can start to think maybe something's happening here. But it's also really important to talk to young people and to do a care and support needs assessment. So what we say and what young people say and have told us is that the best line of defense against exploitation is to make sure that there's nothing that can be exploited. Because if there's nothing that a person can exploit, there's no abuse that can happen.